You struggle to say no to that second biscuit. Maybe you can't resist a slice of cake. If so, join the club. There are people like me who just can't say no to a bit of confectionery, addicted to sugar, just like a junkie might be hooked on heroin. An article published in the British Journal of Medical Science is arguing just that, claiming that sugar acts on the brain like a drug, leading us to crave more, and that we need to be weaned off our addiction to overcome the global obesity crisis. Can you really, though, equate the compulsion to eat sweet things with the need for a Class A drug, or an alcoholic's desire for a drink? Well, let's hear from Dr. James O'Keefe, who's a cardiologist from St. Luke's Mid-America Heart Institute in Kansas, who co-authored the article. Dr. O'Keefe, good evening to you.
Good evening, Adrian.
Hiya. And Dr. Hisham Ziauddin, who's a psychiatrist at the University of Cambridge, who studies the neuroscience of eating behaviour. Dr. Ziauddin, good evening to you as well.
Good evening.
I'll start with you, Dr. O'Keefe, because are we really addicted, in the true sense of that word, to sugar?
Well, not in the sense that you can have a life-threatening withdrawal complex and you can't kill yourself with an acute overdose. But certainly when you look at the amount of problems our sugar intake has caused to the American public and the British public, I often say that the evil white crystal compound that causes more deaths in America is not cocaine. It's really white crystal and sugar. So
the evil white compound, as you call it. At the same time, though, it's I suppose this may be true for many other addictive substances as well. It's something that many people find hugely enjoyable.
Well, that's true. But, there's a lot of things that are enjoyable we're finding that are addictive that are okay, like coffee and tea, for example. The caffeine in the context of coffee and tea, we crave it. Again, it's similar in that you don't have life-threatening withdrawals, but that does make you irritable and you have cravings. And so unlike the sort of dependence on sugar, which really does cause a lot of trouble. We have so much trouble with obesity. It's 1 out of 3 people are obese and 2 out of 3 are obese or overweight. And sugar is probably the #1 dietary devil in America, at least.
Yeah, although you could argue that there has been historically something beneficial about sugar. It's evolved over millions of years. Our taste for it encourages us to eat enough calories to survive. So unlike some substances that we might become addicted to, it has a positive side as well.
Well, that's true, and our ancestors ate sugar in the form of ripened fruit or occasional treat of honey. In these natural contexts, there is a lot of good that comes from it. And of course, they didn't have 24/7, 365 days a year access to unlimited quantities. So, yeah, it was good in the past, and it helped us survive periods of scarcity. But in this day and age, that period of scarcity never comes, and those extra fat calories, sugar calories, end up as fat around our midsection and fat in our liver, both of which are not good.
Dr. Ziauddin, can we truly be addicted to sugar, do you think?
Well, actually, Adrian, we've got nothing to really say that, one, in the first place, sugar is addictive to start with, and whether people can actually get addicted to sugar. I mean, this is an idea that's been around in our literature for a while, but it is an extremely speculative one. Yes, we do have a problem with obesity. Yes, we do have a problem with the fact that a lot of our foods are very calorific, have high amounts of sugar and fat. That doesn't therefore mean that these substances must be addictive.
Well, I'm interested in your definition of it then, because wouldn't that appear to be self-evidently true, that we are addicted? We eat this stuff, and then we want more and more of it.
No, it isn't actually, because I think one of the problems arises from the fact that when we say addiction with reference to alcohol or heroin or cocaine, we're actually meaning a very specific thing. We're actually talking about a clinical disorder. Unfortunately, we also use addicted in this very easy lay context, that I'm addicted to shopping, I'm addicted to the show, which seems to suggest that actually those things mean the same because the word is the same. But it's not. Alcohol addiction is not like being addicted to shopping or coffee or watching a particular TV program. And just that equivalence imposes a sort of layer of meaning that doesn't really exist.
So what is the difference then? Because, as you say, in a kind of casual way, many people would describe themselves as being addicted to sugar, addicted to chocolate, let's say. So what would the difference be between addicted in that sense and addicted to cocaine or addicted to alcohol?
So there are several layers of difference. There's one, a massive matter of magnitude, and I think you opened the session by saying, is it really comparable to compare, someone's craving for sugar to to the craving that an alcoholic may have for alcohol, or somebody dependent on heroin or cocaine may have for those drugs? And the fact is, it simply isn't. Actually, what we're talking about there is something that is an order of magnitude higher than anything that we can actually imagine. But of course, if you haven't had that sort of experience, an intense craving for a cake or something that you really desire is probably the closest you have to try and get a sense of what that might feel like.
Although, Dr. O'Keefe, you say that when we withdraw from sugar in its many forms, we do have something equivalent to cold turkey.
Well, not life-threatening. It's more of an emotional kind of dependence rather than a true addiction. But I can tell you personally, just among my patients and in myself, I've noticed for a long time that when I eat more sugar, I tend to crave more sugar. And I often tell my patients, this is a period of sort of, you kind of have to withdraw from it, and you might feel a little irritable, and it'll be harder to resist the sweets and the cookies and cakes for maybe a week or two or a month. But the longer you avoid sweets, the easier it is to avoid those cravings. And when you don't have the cravings, then it's easier to walk by the plate of cookies. But when you're craving it all the time, it's tough because it's everywhere, and it can be habit-forming.
It can be habit-forming then, and what people suffer headaches if they withdraw from sugar? Can you have those kind of side effects? Depression?
Right, there are chemical changes that happen when we eat an intensely sweet treat, including dopamine rise, and some studies in animals suggest that serotonin goes up, and so those are feel-good chemicals. And when we withdraw from the sugar, it's not only the emotional, but there might be some mild physical withdrawal symptoms. But most people just find that it's harder to avoid eating the sugar that's everywhere. And in medicine, we have a Hippocratic oath principle that says, first do no harm. And I think that even though while it's not truly maybe an addiction, it does cause a lot of trouble. And I find it a useful concept to tell my patients, this is a slippery slope, and you're better off just trying to avoid added sugar as much as possible.
Yeah, I mean, what is it about sugar, Dr. O'Keefe, that makes us want it and then want more of it?
Adrian, it's you intimated about this earlier when you said our ancestors for millions of years lived on the edges of starvation, and when the fruit would ripen up in the fall, it would be important to put on a few extra calories to guard against that period of scarcity coming. So I think the taste of sweet is the taste of survival if you are coming into a period where it's scarcity. And so the people who had that desire, that sort of instinctive sort of want for more sweet, would be more likely to survive, whereas these days they're more likely to end up with diabetes and truncal obesity. And I've noticed among my patients, and there are some good studies starting to support this, that among the strongest dietary predictors of dementia, Alzheimer's disease, is a sweet tooth. A lot of my patients with Alzheimer's disease, you ask the family, oh yeah, they've had a very intense sweet tooth during their life. And we do when we get a spike in sugar in our bloodstream, that stimulates a cascade of inflammatory free radicals that can cause inflammation, which is an underlying cause of a lot of the chronic diseases that we struggle with in Britain and America these days.
Interesting. Thank you, Dr. O'Keefe. Dr. Zia-Uddin, does it really harm to talk about it in terms of an addiction if it helps us to understand kind of inappropriate behaviour?
Well, I think you could think of it this way. Could you use a story or a model to help people change their behavior or improve their health? And you probably could. And then the next question is, does it matter if that story or model is true? Right? Now, from my point of view, that is important if it's true or not, right? Because it's only science if it's actually true. And I think that leads into this question. There is a slippery slope there of, should we just use an idea because it's an idea that might be useful regardless of whether the idea is true or the idea is actually valid in any way? And actually, all this stuff about sugar causing a reaction in the brain, that isn't actually backed up, right? Sugar will cause dopamine release in the brain because that's what the brain system evolved to do. But it doesn't cause dopamine release in the brain in the way that cocaine causes release in the brain, because what cocaine does is that it completely throws the control of the circuit haywire. It floods it with dopamine. And that's a direct chemical effect of cocaine, for example. So all this data that seems to tell the story that sugar is like a drug actually is very, very sparse and comes under very specific experimental conditions. But what you can do is certainly weave a story around it to say that sugar is addictive or can be addictive. But I think fundamentally that boils down to being a story.
Okay, Dr. Ziauddin, thank you so much for your time, and thank you to Dr. O'Keefe as well. Loads of getting in touch, I should say, about this whole